One of the country's leading philanthropists, Nicola Forrest, has been here at Parliament House today, meeting the Prime Minister and urging both sides of politics to get behind a new approach to dealing with kids in crisis. The Forrest family's Minderoo Foundation has joined forces with the energy giant Woodside and social researchers to pull together a report which, for the first time, examines how much state and federal governments are actually spending on things like mental health, on homelessness, on justice services for young people. The figure, it's a big one, more than $15 billion a year. Now, this collaboration of groups says that money needs to be better targeted, not necessarily increased, but better targeted at early intervention to identify and fix problems before they spiral. They're not saying there's a silver bullet solution to the growing problems of mental health and homelessness and so on amongst young people, but they are saying there's a need to rethink how we're allocating resources. I spoke to Nicola Forrest about this earlier. Nicola Forrest, good to talk to you. Tell me a bit about the project you're launching today and the research that's gone into this. What is it showing?
Well, David, thank you very much. The report that we're launching today has been a culmination of work with not only business, but philanthropy and leading research institutions. So this is a first of its kind. And what we're announcing is the cost of lead intervention. And that bottom line is over $15 billion a year that we are spending here in Australia on services and on crisis mode for children.
So we're talking about kids who are at risk of a whole range of things, right? We're talking about mental health issues, we're talking about homelessness, and the cost of leaving the helping hand until too late is this $15 billion figure, is that right?
That's absolutely right. It's almost like the cost of doing nothing.
Right.
However, Australia is a passionate country and we do provide services. I think the thing that we're missing here is that those most vulnerable and those that need those services most are often the last people to access that. So what this report is actually a call for is early intervention or investment in the early years and making sure that we make those services ready and willing and able for those people that need them most.
Well, how easily done is that? What is early intervention? What does it look like? What are you actually suggesting needs to happen here?
So there are a lot of great examples across Australia, and Minderoo Foundation has been funding a program in Western Australia where early intervention is as simple as having someone at the school gate that helps make sure that those families with young children are being taken care of, their needs are being met, so that by the time they come to school, they're ready to learn and their trajectory for life is on an upward projection.
So making sure they're properly fed, making sure they've got the school equipment that they're going to need, those sort of basics?
Well, those basics, obviously, but when you look at some of the statistics in this report, I think some of the more alarming ones are around mental health issues, that's increased by 25% in over a 6-year period.
Is it easily to spot at an early stage kids that are at risk of a mental health problem?
Well, no, I don't think it is, and I think that's part of the issue here. So where the science and the data points to is that in those first few years of a child's life, where all the motor neurons are being developed, their social, emotional and physical well-being is determined by what happens in those early years. So if we're not giving children a holistic approach to that development, then we're seeing these problems later in life. And that's what this really is a call for, to make sure that all of us, and this is not just a call to government.
That's what I was going to say. So what are you asking the government to do here, and I suppose other sectors of the community?
So the government is already providing the safety net that we see, $15.2 billion. OK, we're not saying take that away, but we are saying let's look at how we can reallocate what we're already spending money on and invest it more wisely earlier so that people can lead a full, productive life.
So you're talking about being able to monitor at an earlier age where kids are at risk, and does that involve in the classroom as much as anything else?
Look, it starts from birth. So we shouldn't be letting, and I'm talking particularly around there's at least 20% in our country that are slipping through the cracks. So 80% of us are doing pretty well. But let's not let those 20% slip through the cracks. And it's as simple as having, as soon as a baby is born, that maternal nurse or that hospital, that child is nurtured and looked after by our society. It's very overwhelming being a parent. And if you don't have support services of an extended family, you've got kids yourself, David, you know what it's like.
Yeah.
So if you don't have those supports, then it makes it very hard for you to give your child what they need. So it's as simple as that.
And just finally, you're confident the message you're pitching today is getting through to those who need to hear it, that we are going to see some change?
Well, I believe that this report, which gives us that $15.2 billion cost, is the culmination of work and conversations that have been had over the last decade between research institutes, between philanthropists and with government. And now it's great that business are coming on board as well. They want a productive nation. They want to be able to employ, you know, the employment figures are showing that youth unemployment is also increasing. And a lot of that is tied up to bad outcomes in education.
No, indeed. Well, good luck with it. Nicola Forrest, thanks so much for talking to us.
Thank you, David.